Thank you all for joining us once again. Today, we're going to talk about integrating gender perspectives into new digital products and services. And this series is brought to you by EAT Health Innovators Community. Now, if you're not aware, please allow me to introduce the community to you. EAT Health Innovators Community is a network of around 4,000 plus members from across the world who are passionate about building building a network of people who want to progress, who want to build innovation and entrepreneurship in the healthcare sector. In this community, you find all kinds of people from students, researchers, scientists, entrepreneurs, CXOs, and so many. Everybody who is part of the healthcare sector, healthcare network is here in this network. And we want to invite you to be a part of this network. Why should you join the network? There are a lot of wonderful reasons that you can see on the screen right now. But I can say from my own personal experience and also from the people that I've met in this community, they have benefited in many ways, from being able to partake in wonderful trainings and sessions and ability to go to attend different healthcare summits across the world, getting free tickets and discounted tickets over there, and being able to network with like-minded people or other people for their business ventures and so on, find the co-founders and whatnot. The opportunities are immense, possibilities are endless, and this network is just growing. And I definitely believe that you would you'd benefit a lot from joining this network. Some of the things that we have on the platform is that you can see the members, where are they based, and you can see who are the members around you, and you can reach out to them. There is also an opportunities and job section where you can see jobs exclusively from the health sector being advertised over here. And members, these are the companies that we work with, we partner with them. And when you apply through our platform, of course, you get a slightly added edge in a sense. And we have a lot of events from healthcare summits to EIT health events to info days, and even one of these female leadership events. You'll also find the second episode also right there, and you should definitely check it out of what's up next in the innovators community. And lastly, please do visit community.eithealth.eu if you have not joined yet, and during our sign up, and we are looking forward to have you on the platform and to have some engaging discussions over there. With that being said, I would like to introduce Hanane, the moderator for this session. She's joining us from Belgium, and we have wonderful speakers along here as well, Eva and Helene, whom Hanane will introduce. And let's begin the session right now. Hanane, the floor is yours. Thank you.
All right. Thank you very much, Krishna. Hello, everyone. Very nice to see people in here for this first episode of the third season. As Krishna mentioned, the objective of the whole webinar and the whole season is to be able to discuss about female leadership. And for this webinar in particular, we wanted to think about and discuss the angle of product development and how do you actually integrate gender perspective into digital products. So in here, we have Eva Turk, who will be representing, let's say, more of the regulation and policy side of product development. And we have Helene, who's a project manager, and she'll be able to go into detail of what she does, first of all, and then the why this topic is so important for her. And then we'll be able to discuss really the why is it important for the industry, for society, to be able to integrate gender perspectives, the how we can actually do this, and then some practical what's and some success stories that we already have been hearing about. So without further ado, I would love for Eva Turk maybe first introduce yourself and then tell us why is this topic important to you?
Hi and good morning from my side. You saw that I'm in Las Vegas currently, actually on holidays, but this was such an important topic to talk about. So I said like, okay, let's do it. So I work as a researcher and a policymaker. Actually, I work at the Center for Digital Health and Social Innovation at the University of Applied Sciences in St. Pölten, and I also work at the Ministers of Health office, where I cover health technology assessment in Slovenia. So today I will actually then address a little bit more the policy perspective and the regulatory point of view. And just to give you a little bit of the glimpse into my background, so I have a PhD in health-related quality of life and patient-reported outcomes from Oulu in Finland, and I did my MBA in healthcare management at the University of Economics and Business Administration in Vienna. So throughout my life, I've been working with health systems and looking into kind of like different perspectives, how we can improve health systems and create a more safe and sustainable healthcare. And then I lived in Norway for more than 10 years. And there I got involved a bit more into the gender equity, female leadership, and as such, I've been I was a president of Professional Women's Network in Norway, and I'm a founding member of Women in Global Health in Austria, the Austrian chapter. And maybe we can talk a little bit more about this. It's also kind of like building the community, and bringing it to my why. What you asked, Hananya, is really last year I moved from Norway, where I said like I lived more than 10 years, back to Austria. I come to I am from Slovenia originally, and the decision of moving closer to my home country has also to do something with the gender perspective, in a way that I am the only child, and my parents will sooner or later really rely on my help and support in their activities of daily living. And I think many women, we will also talk about this, are often the informal carers when it comes to their next of kin. And this is where the digital health can really help in improving the life of the families, if I take it like this. So in that sense, I think the gender perspectives are essential also to bring it in to regulatory and policy perspectives. I will stop here, and then we will talk more.
Thank you very much. It was really interesting, and indeed, the why we can feel the passion, and we can see your why just by the few minutes of talking right now. I would love to pass the word to Helene, and then, as you all noticed, we have our third speaker that joined us. So welcome, Marilu. Then I will be able to ask you the same question of, could you present yourself in a few minutes and tell us your personal why of this topic? So Helene, I give the floor to you.
I'm really honored to be part of this first session of this female leadership program. It's a topic that's really close to my heart as well. But I want to start with introducing myself as well. I've been working in healthcare like the past 8.5 years and have a background in health economics. Then straight went into healthcare management. I was coordinating 24 clinics in Austria for like a global company that is doing healthcare, building hospitals, but also managing them. And then I completely really put myself out there to change healthcare in terms of digitalization. So I really joined the club of digital transformation of healthcare. I'm now working for ELGA, that's the Austrian electronic health record. So we are basically providing the whole system for the country, and I'm responsible for bridging all of that infrastructure that we are building to Europe. I'm very much involved with building everything concerning the European health data space, a topic that's also been close to my heart like the last years. Besides my roles as project and innovation manager, now also program manager in ELGA, I've been basically joining a lot of initiatives aside to really drive digital transformation. And I've had the feeling that data spaces and the data space technology will be one of the core features in really putting that forward. So I've been also joining the team of the Data Intelligence Offensive as in the board of directors in 2019 it was. So I've been part of the board quite a long time by now, and trying to push data space technology in Austria. I do that aside, fully voluntarily, of course. And I've also been involved with building up an innovation cluster that's called the Future Health Lab in Austria, that are basically a company that's really driving and bridging together unlikely allies in healthcare to really push the topic. It's also very tech-centered, but also is really diving into how we can basically transform healthcare as a whole, because there's a lot of challenges coming ahead, as you all know. So this has been my background the last years. And then I want to bridge it to the why, because it's something that's very close to my heart, and it's been just undermined by the World Economic Forum 2 days ago. There has been a huge publishing going on. It's all about closing the gender health gap, and it's incredible. If you just look into the numbers of what you saw there, I'll try to quote some of the numbers. I think we can't even grasp the big health gap difference we have in gender perspectives. It's a $1 trillion opportunity to basically improve lives and economies. So the data that has been found is that if we now set the right decisions, it's a benefit of 1 trillion increased annually by 2040 if we now try to bridge the gender health gap. It's just such a huge number. And we've been living into a reality the last couple of decades, basically, where we just really were not closing the gap, but we were basically accepting the gap. And I think it's time to simply say no to that and start to really, take measures. And I think it's us and also our generation that can change that. So it's something very, very close to my heart, and I'm really happy to be here. And let's grow that community together. And I think by now I'm gonna give further to Marilu.
Yes.
Thanks, everyone. So I'm sorry to have arrived a bit later. I was trying to figure things out. So I'm very happy to be here. Actually, I come from a bit of a different background. My background is more in entrepreneurship and sustainability, also linked to digital innovation. So my background is actually in architecture. I studied architecture, but my interest and motivation has always been sustainability. So the first topics I explored were how we can optimize buildings' energy consumptions, how we can build platforms to monitor the energy consumption in buildings. And I went on to explore further what it means to calculate environmental impact of infrastructure projects, and afterwards at product level. So my path was, first of all, in corporate environment. I was a project manager in Siemens in London, where I was supporting the rollout of a digital platform that would calculate carbon emissions in cities and carbon emissions reduction potentials when we integrate green technologies within cities. And after this corporate experience, my motivation was so high that I decided to work on my own projects and build my own products within the sphere of sustainability. And I have launched to the market products which have included hardware as well as software solutions, always within sustainability, both in the sector of electronic waste and in the sector of packaging. And from my side, gender inequality hasn't actually, I haven't really questioned this too much in my career. And that's why I have maybe a bit of a different perspective on this subject. Because I just have been mainly feeding from my own motivation, and I didn't care whether, because it is a reality that there are not enough women also in the entrepreneurship area, especially in Germany where I live now. And it is a reality, but that's not something that I question too much. I just went I followed my passion. I went for it. And I have, of course, came across some difficulties and challenges along my path, but I haven't really associated that with the fact that I'm a woman. However, when it comes to, for instance, raising investments and convincing management, I had the experience that if you're a man, you can be more convincing, and the level of risk taking and confidence level are two things that men in general can communicate in maybe an easier way that is more convincing to people. And yes, I've had also, I felt sometimes that I wasn't taken too seriously sometimes. And so I had to fight a bit harder in comparison with my peers, entrepreneurs that were men. So, but I've had my successes and I'm very happy about it. I launched my product in more than 4,000 point of sales in Germany in 2021. And yes, working within a community of women, I have to say. So that was also really, really helpful, and that I really support further development of.
Thank you. Thank you very much. Indeed, entrepreneurship is such an important topic, and we can see that there are disparities as well when it comes to this field. Not only just about the products that we build, but also in who is building the products and the innovation. So thank you very much for that. I would love to again go into the why. We all talked about our personal why. Now, why should actually the industry care? Why should the tech industry take into account gender perspectives? And why didn't they do it? Or maybe not as much? And why should be a priority now? Those are three big questions. But Helene, I'm sure you can start us off.
Of course. So your question was basically why didn't they previously, and then why it should be a priority. To go into a root cause analysis of why is probably quite hard in our time slots, but it's quite let's say imperative to see how this whole gender health gap that I was mentioning previously, how that all came along. So coming from like product management and project management and very much tech, let's just take our cell phones. It's interesting if you just look into how cell phones were designed. You do have even a gender gap in basically the usability in the UX design when those things were designed. So for the very start, if you unlock your phones in the very beginning, like if I have this screen, my thumb would go here. By now, that's fine. But I don't know if you remember, there have been like the first versions where it's been quite hard for some women actually to reach your thumb authentication line. And that's interesting if you go into the why, because there was basically a data gap, because more male people were invited for the UX design. So they never even came across that women who have have smaller hands just by nature, usually, statistically speaking, than men, that would be like in their data. So they would design it according to the people they tested with. And I think we can just take this as an kind of like metaphor, an analog on how everything came along all the way. We have like this tremendous health gap. And I'm talking about like that women are 7 times more likely to have a heart condition misdiagnosed or be discharged during a heart attack, 7 times higher women than men. So this is like a big disadvantage. That's just hard rocket numbers, you know? So in healthcare, in our industry, that's a big issue. And why? Because there's a health data gap from the very, very start of all the studies we've been building on. And I think maybe Eva can go into it a lot more into detail because it's her background in research. But just thinking about that, I think we clearly know we need to work on our data. And I think that probably is like one of the strongest answers for going into like, why has that been like that previously? Now we see it, now we analyze it, and I think now it's the time to just take a step. And I think that's also kind of like answering the priority question. Why should it be a priority? Because it's basically taking from all our society's capacity. So the human capacity, I mean, we are women, we make up more than 50% of this world. So if this is making a difference for more than 50% of this world, I think the priority should be quite clear. That this is of course like a huge market size, and if we don't take action, we're like leaving people behind. And this is, I think, everything that needs to be said on that topic of a why. And I'm gonna close this statement so that other people have more time.
Thank you very much. It is indeed a very strong why. I would love to hear Eva talk about this and more into the health technology assessment aspect of it.
Yes, I think, Helene, just to build on what you said, there's a great example back in 2017. It's been many times quoted from the NHS in the UK, where they developed an app that basically was run by AI, and there was a female. There's this example of a female smoker, 59 years old, that used the app, and the app was actually, kind of like giving you decision support in a sense of, kind of like, okay, these are your symptoms. Call a doctor. Do this or this, or do nothing, right? And it was quite interesting that women got different response than men, in a sense of, the woman had symptoms of a heart attack in a way that kind of like she had like short she had chest pain, short breath, and so on, and she got the diagnosis of a panic attack, whereas a man had the diagnosis, kind of like a potential diagnosis of a heart attack, and was prompted to visit the doctor or the hospital. So I think in that sense, it happens in one of the best systems or health systems in the world when we look from this perspective. So it's really important to address all of these questions. It's also with medication. Maybe it's not goes directly into digital technologies, but there are different ways of responding to medication. With regard to the clinical trials, what you said, Helene, it's the same. It's way more men being in the clinical trials than women. Of course, this is changing now, and this is also kind of like where then the policies can play a role. And Hanan, what you said with regard to the health technology assessment, we are still not really doing it, but there are opportunities to demonstrate how then gender perspectives are taking into account when applying for the technology to be reimbursed by the system. Because I think this is at the end of the day where the producers, or in a way developers, you want to be reimbursed by the system. One thing is if we are developing wearable devices that are below the medical device range, but other other than this, you need to get kind of like an okay from FDA, from European Medicines Agency, and so on. So in that sense, there are possibilities to include these things in the regulation of health technologies assessments. Yeah, so I'll keep it at that.
All right. Indeed, I know there's so many whys and hows as well that we can tackle. But I would still love to maybe delve deeper into one or two hows of how can regulation support this, because we just discussed the why. We know why this is important. We know why we should work on this. And maybe I will give back the word to Eva again. I would love then to have the thoughts of Marilu on this topic of how can regulation help, and then for Marilu it will be how can entrepreneurs work on this as well.
Yeah. Well, I think with regard to regulation, it's just what I said. HTA is in a way also enabling then the technologies to enter the market, and if we put this aspect into the HTAs or the different policies, then of course this can it can make it easier to enter the market. There's also another thing that where policies can play a very important role, which is also with improving the digital health literacy, right? And this is not maybe necessarily with regard to kind of like speaking about, again, kind of like how women need very different approaches than men, but I think it's more with regard to, again, taking the bigger picture of the social determinants of health with regard to usability of this kind of devices, and how can it really make a difference, right? And there are a couple of examples from the US where it was especially with more vulnerable populations, with kind of like from the lower economic status, or especially in the US, when you see among African American or Latina women that, let's say, they are statistically shown much less physically active or eat less healthy than the others, and in that sense, they need different types of nudging for using the digital technologies than, for example, their counterparts. So in that sense, it is kind of like the increase of digital health literacy can be part of the policies when it comes to improving the gender perspectives also on the in the health systems.
I fully support what you're saying, Eva. I think they're like having programs about digital literacy for women. That's also like a super important point. Also, like pushing the professions within the digital innovation for women, but this is already happening a little bit. I came across a lot of programs offering, for instance, coding programs for women, and also in the area of entrepreneurship. What I would like to add in terms of regulatory aspects. So since I am in the sustainability field and I've been working intensely in this field, there are a lot of new regulations entering, especially in the EU. And you might have heard, every company needs to have some ESG report, which means environmental, social, and governance. Mm-hmm. And within these regulations, there is also this equality within company. So from the EU, there is this push for having more equality within the employees of a company. So companies are obliged to report how many women versus men they hire or they employ within or the company. And yeah, that's something that's being done at the moment Of course, now it's only about reporting it, being more transparent about it, but that's the first step for regulation, to actually being aware of the problem so everyone can know and then do something and act. And of course, companies now, they have to have ESG targets, and most of them, they have objectives of increasing the number of women within in companies.
I totally agree. You cannot improve what you cannot measure. So when it comes to sustainability, whether it is social, economical, it's super important to actually be able to measure, and then you can be able to see it and then do something about it. And when it comes to the what can we do about it, I would love to ask Helene the question of, all right, what can we do about it, to put it bluntly, or how would you, in an ideal world, like to tackle it and see people in society tackle it, as maybe first from your perspective as a program and project manager, and then if you have other thoughts on a broader perspective.
Yeah, it's a good question. And I'll try to link it also to Kate's question from the chat. I think there was a Q&A question. I'm going to read it out so everybody can hear it as well. She asks, how can one strike a balance between addressing the different needs without reinforcing stereotypes? How to balance that thin line here? I really like the last part, like the thin line, because it's really true. It is a thin line, and avoiding bias and stereotype is, I think, one of the crucial parts to even close something like a gender health gap, and also to come forward with this whole topic. So unintentional biases and stereotypes in digital products, that's really a problem. But I think there is basically one joint solution that could maybe really make a difference, and that's all about inclusive design and innovation. So inclusive design, if you really go into that, is basically nothing else than the topic of today, of this session. It's about integrating gender perspectives in the development circles. So it's actually, if you go into usability and user experience standards, you would go into that and see that by picking out like the people you're going to test your technology with, that needs to be balanced. That needs to be balanced by age. That needs to be balanced by gender. That needs to be balanced by a lot of different factors. And the more balanced it is, the better a product will be. And the better the market fit for your product will be. So depending, of course, of in your sector, like if you're fully in femtech and you're building a product, let's say for period management, that probably would only target women. But then also you would go into different age gaps. You would go into different societal, socioeconomic statuses of the people you test with. So the broader you scatter basically the people you're gonna test with and those whom you're gonna integrate into the design processes, the better we can basically tackle this gender health gap in our technology and in our product development. We do that a lot within the technology we build because we need to do it for the whole society. So that's just basically a standard we need to go forward with anyway. But it's incredible. I've been part of setting up the vaccination program, like the digital one, and we had like different kind of like ideas and apps coming up, and we tested that with different people, and it was incredible to really get the real perspective of the people, because we had like our hypothesis, what a mother of, let's say, 2 children will want in their app. For like monitoring the vaccination status. So we were basically trying to stereotype based on the persona to then come up with like requirements for an app. But then if you really include the real perspectives, a whole new world is coming to the table. So with a lot of things we were right, but we were learning a lot by the real example. So I think really bridging that gap between theoretical requirements and basically relying on stereotyping as a method to really bring in real people and actually use user experience norms as such, as a standard. That would already like make a huge difference and would also enhance user experience. By that also including like maybe different digital literacy concepts that we just discussed before. And I think that would be kind of like an answer for how to do it, and also on a regulatory perspective, especially if you do like public management or like products that are relevant for like the whole society. That's something that you could regulate to basically that the company who is building whatsoever really needs to show that they actually did that. By that, we're bridging the gap already just by relying on those standards. So that would be, I think, one of the key factors I would suggest that we're going to do.
Yes, exactly. If I just may add on, because I think this is also part with what I mentioned with regard to the HTA. And while you were talking, you reminded me of a hackathon that I was part of a couple of years ago with the Norwegian Red Cross. I worked there as a public health expert in the emergency health unit. But the what we were doing, we were developing community-based surveillance digital tool. And it was really interesting. This was going on in Oslo. We brought, all of the experts, everybody together, and then kind of like thinking, how can we improve the tool to, to kind of like cut the curve, of the outbreaks. And then we were thinking again, some apps and so on. And we said, okay, a lot of people in Africa already have the cell phones and so on. But yes, they don't have smartphones, they have feature phones. So we had to go back, with regards to, how we are developing things is going back to the text 1212 and so on. So this is also part of the whole process, what you were talking, until actually we got colleagues from, let's say, the Mozambique Red Cross into our hackathon. It was like, no, we were thinking about developing a pretty cool app. So these are very important topics that actually affect everybody. And I think what you were saying now with regard to the stereotyping and so on, I fully agree. The standards needs to be in place.
I love this. I think the statement that we could have here is, if you don't build it with us, you won't be able to have the right product. So I think when you have to build something for a certain audience, you have to include them in this process. Otherwise, you will build something that you think is magical, but just won't be used because you do not know, you do not live what the other people live. And so you need to include those perspectives. So thank you very much for that. And before I ask my last question already, I would love for the audience to text in and send in their questions as well. Thank you very much for the first person that asked their questions. And please don't hesitate to put in the chat. It's going to be on your right side of the screen. So we'll be waiting in the next minutes for your questions. But my last question to the speakers will be, do you have something else in mind that we have not tackled today that you think is important to share with the audience? And I will maybe start with Marilu.
I need some time for this. Maybe if Helene or Eva have already some answers.
I think if I may, I think it's very important also to develop role models. And in that sense, what we are doing today with regard to the advocacy and bringing the issue closer to the wider public, but also when we talked a bit about the female leadership and how very few actually female leaders are in like are the CEOs of the tech companies and so on. So it's very important to have these role models in mind. And for me, it's sometimes for me myself, it's mind blowing when somebody asks me, have you ever met this CEO or whatever, and then it's immediately I think of a man in a gray suit. Still, no matter, kind of like for 7 years I've been working with this and having in the back of my head, about female leadership and so on, and I still have my unconscious bias present. So in that sense, it's also what we have are trying to do. And if I may just use this opportunity to talk a little bit about the mentoring. I think the mentoring part is really important also for the different generations of women, right? And when we speak about mentoring, it's for me, it's I always speak about the reverse mentoring in a sense, because it doesn't go only one way. It goes always like two ways. So the different generations have different things to offer. And I think with regards to that, we often also need some nudging from somebody else that kind of like reinforces, our thoughts or our aspirations in a way. So that would be something that I have found quite important. I didn't have a mentor, when I was a young professional in that sense, and I was not even aware of the concept. But then later on, when I was working in the corporate sector, I saw kind of like people were having mentors and so on. So for me, it started with an informal mentor, and I saw how much it actually gave me, just to have this kind of safe space of discussing your doubts, with somebody who is not necessarily your friend or family. So in that sense, I think these kind of programs really help us create our professional path, also maybe more targeted in that sense.
Love this. Helene?
Yeah, and I think continuing to that, um, yeah, I think also it should start also from childhood, because also for me, I didn't have like a role model when I was young, and I think if we can also integrate into the society more female role models from the early years, that really could make a big difference than how we develop as women when we grow older, and our confidence level and risk taking level. And I would really also encourage to follow the passion. I think I've had the experience that men are more confident in what they believe rather than like in comparison with women. So it's something that maybe we can push more, like really supporting women and supporting their passions and their beliefs. I mean, in my experience, this determination came from negative experiences, and that's how my confidence and determination were built. So I didn't accept these negative experiences or negative things that happened to me, and that's what pushed me a lot. And I think if I didn't have this, it was kind of like a slap in my face, but it was also painful. So I think my motivation came from pain, which has been an interesting journey. But it can also come from a positive and enforcement perspective, and it's something that should be integrated along the life and the education programs of the person.
Thank you. Thank you for that. Helene?
Right. So, yeah, I'll try to bridge it from my last answer. So basically going into like practical tips to really integrating gender perspectives in a better way and to really make a difference. I think one thing I already touched upon, it's really like integrating it into your product development with like external people coming in into your design processes. But we also know that the design processes, even though integrating like potential users, that's like one thing. But the other thing is how you're gonna set up your team. And how your team is going to be set up will determine a lot of the success of your project, of your company, of whatever your endeavors basically are. And also there, bringing in a quite balanced gender perspective, I think can really make a difference. Marilu was touching upon it with the ESG goals prior, with like having like the ratios of basically gender in your teams. And what we know is if you really set up your team in an inclusive way, and I'm not only talking about gender perspectives, but as well, very much so, we know that all teams, it's kind of like incredible having the facts on the table. We know that inclusive teams make better business decisions than non-inclusive teams. They're even 87% better than non-inclusive teams. So it's something that should basically be a new normal if we just want to do great projects. So having like inclusive teams would bring, and that's what data shows, inclusive processes. So it's kind of like integrating gender perspectives in product development would kind of like come along quite naturally. You don't even need to enforce it with like management theory and management models, you know, it would just come along. And usually even the development processes are twice as fast if you have an inclusive team. Because like balancing out even gender, I mean, you can't stereotype, but balancing, and I think that that's the key message, trying to have like an internal balance within your team, but then also bringing the balance from the user feedback, that will really make a change. And then I want to like basically wire back to the why from the beginning, because I think that's also very practical, a tip, and that you can also see like in a lot of successors out there. I think, and that's basically touching upon what Marilu said. She was talking about like what's driving her, all right? And I think with what I said in the very beginning, that it's the time to act. It's our time to make a difference. So I think I just want to encourage everybody to listen inside everybody's own heart, or like models that they want to follow, and like the difference they want to make in their lives. And if there is something about making a difference for society, looking into this gender health gap, I think, is a very good idea, because it's just one of the biggest, and right now it's on the World Economic Forum. It's like one of the biggest crises getting this data right now. So actually the whole world is talking about it, and we can make a difference with it. Femtech is like one of the most growing markets if you're in tech, and it's one of the highest invested markets as well. So that might be something where you really take your step up on, or in your role as like a manager, as a team member, no matter where you are at, I think you can bring in a stand for integrating gender perspective. And the moment you just address it in your team, that will make the difference. And I think it's a lot about just speaking up and making the difference and just taking it into your own hands. And I think that's the most I could give. It's encouragement. That's also why I love this setup that we're having right now, because it's a lot, not just about talking about everything, but then basically supporting each other. Find your peers, find your supporters that will help you grow into the vision that you're creating right now. And then it's just going to become reality.
Wow. Thank you very much for this. It's a nice way to close off, let's say, this webinar. If I have to recap it in a few points, my main takeaways would be, first off, the time to think about gender perspective is now. It was yesterday, but now is a good time to start, because the gap is not closing off. The gap is widening. So we need to talk about it. We need to do something about it. And the way that we can do something about it is with the different genders and not for the different genders. So when you build something, the people that you build it with should be included in your data set if it's something about AI and more software related, or when it comes to services, with the people themselves giving their perspectives and opinion. So thank you very much for all of your perspectives. It was really interesting to hear about the project management side of it, the entrepreneurship side of it, of how do you actually live it in different, with not just in digital health, but also with sustainability. And then, of course, having more of the policy and regulation side of it. So thank you very much for the very interesting webinar, and I will give back the word to Krishna. But thank you very much for the speakers, and thank you for the audience for being here with us today.
Visit community.eithealth.eu to join our community and shape the healthcare landscape with us. For more such videos, subscribe to our channel.